thank you very much. Okay, you can sit here. Yes. Okay, before we talk about the future of healthcare and more specific about the role of home care, we're going to talk about innovation about healthcare between home and hospital, and therefore we have a little short movie clip that we can show you. Let's watch the clip.
We face daily challenges, but what if small changes in structure could make a world of difference for both patients and care providers? Let's start with the most common procedure, treatment at the hospital. Most of the time, the patient gets their blood drawn, chemotherapy, and other consultations at the hospital. Everything is centralized in one place. This gives care providers full control. Equipment is at hand, communication is direct, safety is guaranteed, and logistics are in order. But for patients, it's often exhausting. Long travel times, emotional stress, and trying to find their way in the maze of the hospital. Not to mention the difficulty with transport, busy traffic, no parking spaces, and a long route to the hospital. Not the most ideal situation for the patient who we care so much about. So we tried to make it convenient for them with Onco at Home. The patient gets their care in a familiar environment by a professional caregiver. No need to travel, and they have a sense of comfort. Ideal for the patient, but not for the care providers. This brings logistical and safety challenges. Blood samples must be transported under strict conditions. Chemo must be fetched in the hospital, and the hazardous waste needs to be returned for safety. A logistical nightmare for the care providers. The leading doctor also loses their control over the treatment, which is not the preferred situation. Now picture a third scenario, a local care hub, a small-scale centre close to home where patients receive treatment in a controlled, professional setting. No more long travel or hospital mazes. Regular specialised staff ensure continuity, and the transport of samples and waste is centralised and efficient. Communication between care providers improves, and the supervising doctor remains closely involved. Everyone is informed, connected, and confident. A local hub is not just a concept, but a step towards a more humane, more connected, and more efficient cancer care for patients and the caregiver. We're inviting you to help us build this future.
Okay, thank you very much for the movie clip, for the technical people. We're going to talk about home care. Willy, can you tell me what the problem is?
Well, at this moment, cancer treatment is a challenge in a few ways. Let's say one of the problems is safety. We have to get the blood samples on a correct way in the lab of the hospital. We know that there is a problem with the storage of the cancer treatment, the chemo. Let's say a proper formation of the healthcare givers is one of the problems at this moment. And we are talking about hospital and first-line care as two opposites. In fact, we have to talk as some continuity between the hospital and the home care system. So we have a few unclear responsibilities at this moment. Responsibilities in the clinical pathway of the cancer treatment. So the stress, the comfort for the patients. These are a few of the problems we have at this moment.
Okay, and there, Simon, I'm going to ask you the same question. Despite all the things Willy told, is there another problem
I think
you want to talk about?
overall you have an ambiguity in evolutions. So at one point we're excelling in personalized care, high technological care, innovative care, which is good from a medical point of view. On the other hand side, it's very difficult to bring that to the patient's home. While at the patient's side, you see that patients are getting more talkative. They want to be more involved. They want to have a personal, closed environment.
Yeah.
So those evolutions are both quite good, but they're heading in the opposite direction. So we have to find an in-between at this point for new technology to bring them to a local stage.
Okay.
But on the other hand side, provide the correct safety to do these new innovative things at very good standards. I think that's the main issue.
Okay. Jos, how did you get personally invested in the project we are talking about, or we're going to talk about?
Yeah, very important to know is that Onco at Home
Yeah.
is one of the trajectories of a larger project. You know that WONCA, the World Health Organization of Family Medicine, defined 5 core tasks for the GP. First, prevention, acute care, chronic care, also end-of-life counseling, and the last one is the care organization. So there is a large problem nowadays.
Yeah.
We are confronted with a lack of capacity of care. So we developed an out-of-practice new care ecosystem with 7 pillars. First one is early detection and prevention of chronic diseases. Second one is chronic disease management. The third is diagnostics. The fourth, population management. Also living labs for the patients and an educational program for all the care reference team to instruct them. But the 7th pillar is home hospitalization. And one of the important spin-offs is Onco at Home.
Yeah.
Therefore, we are.
And does it work? It's a pilot project, but what are the results at this moment?
It's a pilot project with Mederi,
Okay.
one of the largest companies with 2,200, I think, nurses, and also the University of Ghent, and you can tell it, Simon. That's a pilot project.
It's actually very pilot.
Okay.
So at this point there are no results yet because it's very difficult to organize it. One of the things that we noticed during COVID is that we're going from a place where hospitals are quite centered in our healthcare system and we have to go outside. And in COVID we noticed that there's a large capacity outside of the hospital. On the other hand side, it's the challenge is to organize this at this point without the right legislation and modalities because we don't have it at this point. So
Okay.
I think one of the main issues in the project is actually the feasibility of it, getting it organized and getting it legal,
Okay.
which is actually the main challenge.
Yeah. And how are you going to challenge it? How are you going to make it more visible?
As you said, I'm a little bit of an anarchist, so we won't wait for
That's
legislation.
what you called yourself.
Yes, that's true.
Yeah.
No, that's my wife. My wife says
Okay.
I'm
Is
an
she here,
anarchist.
your wife?
Yeah.
No.
No.
Okay. No problem.
I think one of the main things that we do with this project is actually we challenge the current healthcare system.
Okay.
And that's what anarchism is for me. It's challenging the things that are and the things that should be and making it better for patients.
Okay. Willy, I'm going to ask you from your perspective, what is currently the biggest frustration in the patient's experience in the traditional patient's track?
I think communication. Communication and working in the same file from the patient. So we have to do a lot in moving to a proper way of communication.
Okay.
That's the biggest problem.
The biggest frustration. You told us, we need to go out of the hospital, Jos. But how can we ensure that a solution outside the hospital is as safe as in the hospital?
That's very important. There are many examples abroad.
Yeah.
We can refer to Gesundes Kinderspital in Germany. You have also the project in Hoivatilat, Finland.
Okay.
So we don't are exploring new edges of healthcare, because there are many examples abroad. Also in the US, you've got Kaiser Permanente. So we've got a lot of examples to refer to,
Okay.
to compare to.
A question that I need to ask is who pays for this, really?
Well,
Is it financially sustainable?
yes. In fact, it's the same thing as we do nowadays. The national health insurance pays all of it, and I think there's another discussion going on at this moment. A discussion with a lot of stakeholders. It's the co-financing of our system, and it's a big problem at the day. But
And what can be the solution?
solution can be that we have to find a system that is paid in the same way as we know it nowadays. And there is a solution, because there's a big possibility when home care nurses do their care in a situation where they find a solution between the hospital and the home care.
Okay.
Because nowadays we are discussing the system as sort of polarization. It is either the hospital or the home care. I think we need something between it.
Okay. Simon, we talk about care at home. The pilot project, how long are you going to let it last?
We're aiming for 2 years now.
Okay. And you're where in the 2 years?
At
the beginning?
At the beginning, yeah.
Okay.
And I think one of the key issues is that we're starting with with oncology treatment, but we want to go larger than that. As you have seen in the movie, we do face, especially with University Hospital, we do face a traffic incident, because we're building a new hospital. It's very difficult, and it's actually quite insane. So patients have to pick up their medication in the hospital, bring it at home. Then one of the nurses of Mederi or some other organization comes to the home of the patient, and then they can give the medication. It's actually ridiculous. And you asked, how can we keep it economic good? How can we keep it sustainable? If we only look at the direct cost, it will be perhaps a little bit more expensive. But on the other hand side, indirectly, the cost for the patient, for society, for also the environment is larger if a patient has to do all those traffic jams and get in the car. So in the end, I think this will be the perfect in-between solution until we reach the point that the technology is good enough to do it at home.
Okay. What exactly does it look like? A warm, close place closer to home? What can I imagine?
I don't like the term warm.
No?
I think we should look for the term connected. I mean, everybody can have a warm place, but you should feel connected with your treating physician or nurse. So I think in the end, you have to find a place in which you can connect with one of the healthcare workers and make a bond with them, because most of the treatments that we will offer at the hub will be long term. So you have to get a connection with somebody that treats you there. And I think that is the main issue, getting connected first and then having a warm place.
But with all due respect, Simon, but is that realistic in these days, in how the system is working at the moment?
I think it is, but we have to make a mind switch. And we said it a lot of times, we have to challenge the system at this point. And I think in the end, if we change the system as a whole, I think this is very realistic. But then again, all stakeholders will have to change their mindset to do so.
Okay. All the stakeholders will do here present. Maybe a last question for you, Jos. How important is that calmer environment to the patient's overall medical journey?
I think it's very important, because when a patient is confronted in a hospital setting with an oncologic trajectory, then it's very stigmatizing. in the oncology department. It's very stigmatizing. So when you as a patient are confronted with a life changing journey, you need proximity, you need empathy, you need trust combined with safety. And that's the most important things, I think.
Okay.
We can provide that. And when we refer another time to abroad,
Yeah.
then the economic burden will lower with 164 euro per citizen. So for Belgium, that means 1.2 billion euros less costs for the community every
Okay.
year.
Are you optimistic, Jos?
Very optimistic.
Yeah?
Very optimistic because now we have to do something about healthcare because it's exploding. The costs are exploding. So we are searching for new innovative projects to give an answer to that, to improve the economic burden.
Yeah. And then your mic didn't work.
Mike, it's paid for, but
Yeah. But if there are ideas, people can present them to you today.
they can reach for us.
Okay.
Absolutely.
You're staying here a whole day, gentlemen. Okay. So people, if people have question for you, they can ask you privately and intimately.
Absolutely.
But do not touch, except
Except the
if you
pralines
want
and
if
the
you want
chocolate.
it, of course. No problem. Okay. Thank you so much, gentlemen, for your time being here. So if you have a question, ask these guys. Can I have a round of applause for these wonderful gentlemen? Thank you very much. Thank you.